Hi guys, back again. Grizz here. This is a continuing saga of medical first aid bags and so forth. And I just want to make you aware of some accessories that you can take with you in the field as an adjunct to your bag. Now you might have airway accessories, you may have IV accessories, you may have splinting accessories. You may have suturing accessory. So we're going to talk a little bit about a suture kit that the Army issues their medics. Navy corpsmen used to get them, and very basic stuff. I've added some things, subtracted some things, and I'm going to let you know where you can get them. This is the I talked about it earlier, the medical instrument kit, minor surgery. This is a canvas one. It's an older model. They come in nylon now, that I've had for many years, that I was issued. Now, within the kit, you get blades. And when I start the class on suturing, I'll talk to you about what a number 10 blade is, what a number 11 blade is, and so forth. Okay, so you get a pack of blades with this. All right. You get needles. These are, I don't know if you can see them through, I don't want to open them up. These are curved martins, which means they're a cutting needle. Mayos are round and taper. These are a cutting needle. These are good for going through the skin, through the dermis and epidermis when you just want to put in quick skin sutures or just retention sutures until you can get them to a hospital just to align the edges of the wound. These are smaller martins, and these would be probably the better size for suturing. Probably about a, I don't know, 2.0 type. Anyway, we have some 0 and 2.0 silk here. This is 2.0 silk. Silk is non-absorbable. It's a braided material. May not be able to see it's black. It's good for ties, tying off vessels. It will not absorb, the body will not absorb it. And you can use it on the outside of the body. What is better is nylon, and I'm looking to get some of that stuff, or I have some of that stuff that I can show you when we do the suturing. Now, when you come upon a wound, some people are hairy, so you have to find the wound amidst all the hair, say on their arm or their leg or whatever. So I carry a cheap Bic razor in my kit, so I can pour a little bit of water on the around the area. I can flush it that way, and then I can shave away from the skin edges. All right. Secondly, if you're not able to find a pair of suture type scissors or dissecting scissors, these came out of a pretty good sewing kit. They're decent. They're made quite well. They're not as cheaply made as the other type of scissors, but you could use it to spread tissue, whatever, cut the skin edges, so forth. If you have the ability to go to a medical supply store, or if you go to a cosmetic with nails and brushes and files and whatever, normally they have some good cuticle scissors, straight scissors. Usually a curve is good for cutting suture and for dissecting, and they can be used in your first aid kit. All right. This is a knife handle, okay? This is a number 3 knife handle. This takes certain blades. We'll take a 10, we'll take an 11, we'll take a 15, so forth, okay? So that's the number 3 knife handle. If you don't happen to have a knife handle or a knife to use for making an incision or to clean up edges, you can get a little paring knife like this. It's sort of a hawk bill. Found this in IKEA for like $1 something. It's stainless steel. Sterilization, boiling water, if that's all you have. You have some iodine you want to throw on top of the blade. You want to put it underneath a match or a lighter for a little bit and let it cool off before you use it. Okay? Or if you got some booze, that's an old cowboy remedy. Throw it in some alcohol, wish it off, and go do your thing, all right? So little paring knives like this can also be used and substituted as scalpels. They're also good for everyday carry type of blades. In this set also comes a pair of pickups. These are Ferguson's. These are without teeth. They have no teeth, except for a little bit of a grind line in here, a tread. All right, used for picking up the skin, throwing in your sutures and so forth. These come in different sizes. They have Ferguson's, they have Adsons, Adson Brown, so forth and so on. They just come with this in this set. Also, you have straight hemostats. Okay, these are Halsteads. They call them Halsteads. These are U.S. made. They have them curved just like this. They're different sizes. There's different lengths, different diameters. All right. They're good for using if you don't have a needle holder. You can use them as a needle holder. They're good if you're going to use a straight needle to pull the needle out from the other side. There's a myriad of uses you can use with a straight clamp or a curved clamp. As some of you fishermen know, you have a clamp with you. I know when to pull hooks out of the fish mouth. Okay. Same. If you want to go to a fishing store and find them, great to have. These are better than pliers, I think, for finer things, taking out splinters and so forth. All right. I have a timer here. Make sure I don't go over 15 minutes. Another thing is, this is a probe. It's malleable, meaning it bends. You can bend it. This is good for lacrimal duct, blockage of the lacrimal duct, of the tear ducts of the eyes. Okay, you want to clean it real good, some alcohol wipes or whatever, and let it dry a little bit because you don't want to burn the eye. And then go into the lacrimal duct. It's also used for fistulas. These are false tracks that the body creates when fluid and pus and exudate can't escape. So they wall it. The body walls it off and creates an opening, like from your anus, your rectum, from a dirty wound, whatever, so that it can drain. You can probe, see how far it goes, because you have to cut those things open so that they will heal. All right. This is a lancet. It's a little sharp, little pointy booger. This is good for popping blisters, boils, infected areas, so forth. Very sharp. It's actually a myringotomy knife. It's disposable. It's used for cutting the ear drum so that the tubes can be placed in kids' ears. Okay. This is another probe type retractor. It's a sharp retractor. Okay, like a Hoffman, whatever. One-sided pull up, debris, whatever. You can cut your skin on it. There's a trough here. You can put it underneath wherever you're going and skin this way and cut on top, and you won't be hitting the other type of delicate nerves or vessels underneath. So it can be used as a guide. I also have some disposable skin hooks. These are good for pulling up the skin edges and aligning or retracting so that one can dissect under or find a bleeder, whatever. The other thing that you can go back on with these clamps, if you got something that's really bleeding, you see the vessel. Now, what I'm telling you is you need to be trained. You need to be familiar with these things. Okay. Only do in all these videos that I'm telling you, only do the things you feel comfortable and skilled at. Don't do anything above your comfort level or your skill level. I've done these things. Okay. Other people have done these things. That's why I want to keep everything simple and not get too complicated. But if you see a big pumper in a gash, say in a thigh or whatever, you take this clamp, you find that vessel, and you get it to where you squeeze it off. When it stops bleeding, clamp it down, you're done. And also there's a way you can put down a single tie on it and tie it off to take the clamp away. If you don't have ties, you leave the clamp there, okay, until he goes to a hospital and they can clamp it down in the OR and unclamp it, so forth, okay? So, in all these videos that I'm talking about, and these are just overviews right now, do what is you feel comfortable and skilled at. Down the road, and it's really hard getting people together to do classes and all, I can and will, depending upon how many people are interested, offer a class on suturing, on tying, and whatever, on first aid and trauma, if one would like. I do this all the time. I make an offer. You get 3 or 4 people say, oh, yeah, I'd love to do it, and that's it. Now, it's not worth my while. I need at least 10 or more to come together. We can camp for the weekend, for a long weekend, whatever, and we can do some triaging and assessing and splinting and evacuating, doing carries and drags and whatever, and I can teach you some of these things. So if you're interested, put it in the comments area, okay? Last but not least is the needle holder, which I told you I don't carry leather or anything. I carry a needle holder. This is an Olson needle holder. And the reason why it's called that, it has its scissors right in the jaw right here. Those are actual scissors. I don't know if you can see them. So I can suture, okay, and drop the needle, cut, and pick the needle back up and suture, cut, pick the needle back up and suture, okay? These are found in the operating room. Plastic surgeons use them a lot, so they do a lot of suturing. Plastic surgeons should be sailmakers because they suture so damn much. And they know all kinds of intricate knots because they work inside the facial cavity, and they want to bring skin edges together so that it's pretty, you know, when at the end of their treatment, their suturing, okay? So these are just short, small overviews that I'm giving you right now before we get into the big stuff. If you have any questions, please comment. I will answer. I look.